Hi, I'm Austin Atwell, and this is my final presentation for healthcare terminology. So, in our first week, we talked about common medical errors. I chose medication errors because it's something that I deal with every day at work. Medication errors are very common. We have a whole system for reporting them and also training in place to fix any medication errors that we make. Training and improved systems can help healthcare professionals to avoid mistakes like these. So that's why training and especially retraining when someone does make a mistake to make sure that that information gets put even deeper into their brain so that they're ready to avoid those errors in the future. Um, Always follow the five rights. That's patient, time, drug, dose, and route. So that's right patient, right time, right drug, right dose, right route. The patient, of course, is you look for the patient name and make sure that you have the right person who's taking it. Time is just the time. It's usually AM or PM, but it could be also be labeled as before bed, um, after eating, things like that. There's also the right drug, which you just have to follow that physician the physician order so that you know the right drug, and you just need to read the label and figure that out. The right dose is hopefully the physician has that marked out. They usually do. If they don't, you should get a physician order before giving any type of drug if there's no dosage provided. And the right route, which is usually oral, but it could also be anal, and there's a couple other different types. Yeah. Otic, things like that. And then you just always want to make sure that your employees know to report a mistake immediately and follow all medical advice from the physician, because you don't want them to be afraid to report a mistake. You want them to know that if a mistake was made, it needs to be followed up because it could be harmful to patients if a medication error is present. So the second week we had a personal reflection. It asked us if we would be good healthcare professionals and what our values were like. And I think I'll be a great healthcare professional. I have biblical values. Honesty is a big trait of mine. I really think that people who are honest should be forgiven. So if someone makes a mistake, all you need to do is, as long as you're following what's best for the patient, you shouldn't be punished as heavily as if you're trying to hide it and all of a sudden it's figured out. Then you should have to deal with the whole thing if you're going to be a liar. So I understand the values that a healthcare professional needs. I'm caring, but I also understand loss. So I worked in hospice, and I took care of. There was one old man that I really connected with, and I really felt bad for him. And we talked, and I helped him out a lot. But when it was his time to go, I really understood he's better off. He's been freed from his pain, and he's in a better place now. So I would say there I got a little too attached to him, even though I understood it. But I think I have a good understanding of what that's like. And I know that sometimes I can get too attached to people like that. But, it's just something I have to work on as I go. And as I get more used to it, I'll be even better at it. Integrity within a healthcare organization. I talked about that a little bit before, but integrity is important within a medical organization, especially with employees, but also with patients. Patients need to be truthful with us. They have to have integrity. That way we can give them the best care that we can. One quote that I found is, "Whoever walks in integrity walks securely, but he who makes his ways crooked will be found out," which is honestly how I would run my healthcare organization. Is those who walk with integrity, you can feel secure that, if you make a mistake or something, we're going to help you out. We're going to make sure that you're not losing your job over just a simple mistake that you were truthful about to help the patient. But if you want to be crooked and we find out, it's going to be, we're coming down on you with the full force of the of our laws. So that's just how it's going to be. Employees should be encouraged when they show integrity. Like I just said, employees will be punished when they lack integrity. That's just how it goes. It's important to talk with patients and staff about second opinions, even though it may take a patient away from you. That's a big part of integrity. It's not all about making money, and it is important to have those, to keep those patients. But if they really want to have a second opinion and they think that they can get better care elsewhere, you have to give them that option, because most times, if not, they'll go for that second opinion and they'll come back to you, because if you're giving good service, they'll realize that you were the right people to go to. And then in our next week, we did an interview. I interviewed Taylor Rainey. She is a healthcare administrator. So she used the healthcare administrators use different terms depending on their expertise. What she did is, if claims were underpaid, which usually hurts patients because the patients aren't getting as much from their insurance company, as well as the hospital's not getting as much. So both sides, the hospital can't give as much care, they're not getting enough money to take care of the patients, and the patients aren't getting enough money to pay, so that's more out of pocket. So what Taylor does is she goes through all the systems and she runs and she looks for mistakes in those reports, in those claims. So she finds where people have overpaid for insurance, or the hospital has been underpaid from insurance, and she fixes that so that nobody is getting hurt in the end. She said that knowledge as well as customer service is very important to healthcare administrators. She doesn't directly deal with the patients as much as other healthcare administrators, but so her customer service is more of an integrity-based customer service, where she sees a patient who's not doing well and she helps them, even if it may take some more money from the hospital or the insurance. And that's her job, is just make sure that all those claims are perfect and nobody is getting hurt by them. And then those are my sources. This class has been awesome. I've learned a lot, and I'm just excited to keep going. And thank you so much. Have a great day.